السلام عليكم طلاب المرحلة الخامسة. موضوعنا Polycystic Ovarian Syndrome Associated Subfertility. The diagnosis of the PCOS depending on Rotterdam criteria. 2 out of 3 it can make a diagnosis. First, oligamenorrhea or amenorrhea due to an ovulation. 2. Clinical or biochemical hyperandrogenism. 3. Polycystic ovaries by ultrasound. Presence at least 12 follicles measuring 2 to 9 millimeter in diameter and or ovarian volume in excess of 10 cubic centimeter. This is the clinical picture of the PCOS: acne, acanthosis, hirsutism, obesity, hair loss, and irregular. How can PCOS causes subfertility? As we know, there is a problem in the hypothalamic pituitary ovarian axis. There is a dysfunction characterized by increased GnRH secretion, lead to the excess LH on the expense of the FSH. The LH will act on theca cell, lead to the increase in androgen. Androgen interfere with the normal growth of the follicle, lead to the follicular atresia associated with theca and stromal hyperplasia. If I ask you what is the cornerstone for the PCOS associated subfertility, you will say it's hyperandrogenism. In addition to that, we have insulin resistance and ovulation infertility lead to the follicular arrest and impaired in selection of the dominant follicle. المشكلة بالPCOS we have no dominant. Look at the slide on the right. It is the PCOS. There is abnormal growing of the follicle lead to this arrest in the follicular development and lead to the multiple follicle arranged around this trauma, give a necklace appearance. This ultrasound, it is a transvaginal ultrasound, show this ovary with a multiple follicle arranged on the stroma, lead to the necklace appearance. Modalities of treatment. We have a 3 lines of treatment. First, lifestyle modification, insulin sensitizing agent, clomiphene citrate. Second, gonadotrophin and laparoscopic ovarian drilling. Third, hyconadna ovulation induction and IUI and IVF. Lifestyle modification. It is very important. We ask the patient to lose weight. Loss 5 to 10% can lead to the restoration of normal ovulation and enhance spontaneous pregnancy. In addition to that, weight reduction will be beneficial during a pregnancy by reducing the risk of the miscarriage and reduce diabetes associated pregnancy. How weight loss achieved? First of all, physical exercise. Second, by dietary. Patients should be kept on diet with low fat and low carbohydrate. Weight reduction also done by using drugs like orlistat, lipase inhibitor. In addition to that, we have metformin. Metformin play important role in weight reduction in PCOS patient. If all these failed, we shift to the surgery. It is called bariatric surgery. Insulin sensitizing agent like the metformin, glucophage, it will lead to the decrease بالinsulin resistance, lead to the treat hyperandrogenism, it treat acne, hirsutism, restoration of ovulation and spontaneous pregnancy. Metformin, the dose 500 milligram should be taken twice, and we can increase the dose until we reach to 1,500 to 1,800 milligram. Below 1,000 it will not act. Side effect, diarrhea, nausea, stomach pain, heartburn, gases. We can reduce this by asking the patient to take it in the middle of meal. أقولها للمريضة أخذ الحباية بنص الوجبة ممكن تقلل من السايد effect. Clomiphene citrate. The details we will take it in the session of Dr. Zina, but here we will take a simple and concentrated information about it. Ovulation induction will take place in 60 to 80% of the cases, but the pregnancy 50%. There is a failure rate. This is related to the number one, the clomiphene will lead to the increased viscosity and make the cervix hostile to the ascending of the sperm. Second, decreased endometrial thickness and interfere with the implantation. This is why the clomiphene citrate failure rate may occur in some of patients. despite of good ovulation. A clomiphene citrate, it will lead to the good response if it's combined with the metformin. Complications: multiple pregnancy, ovarian hyperstimulation syndrome, and in resistance cases, we will shift to the second line. We come to the clomid. This is the tab, show us the clomid. If I give you this drug, I will ask you some questions about it. What is this drug? What about the side effect? What is the benefit of it? For which reason it's used? This is the questions on this slide. Side effect: mood swings, blurred vision, nausea, vomiting, hot flashes, tenderness in the breast, and headache, dizziness, abdominal and pelvic pain due to enlargement. Gonadotrophin, synthetic FSH used for ovulation induction. We have two types, pure GON and gonal F. You should not combine gonadotrophin with GnRH because lead to the high risk of ovarian hyperstimulation. This pin shows us the pure GON, and this is the gonal F. Laparoscopic ovarian drilling. It is a surgical procedure by which destruction of stroma, part of the stroma, takes place in order to enhance ovulation. The destruction done through the laparoscopy by using electrocautery or laser. إذا تذكرون قلنا المشكلة عندنا سترومال هايبربليجيا، فأنا إذا قللت من الستروما راح أقلل من ال LH، راح أقلل من السايد إفكت مال ال LH اللي هو هايبر أندروجينيزم. من ينزل الأندروجين راح يصير عندنا restoration of the cycle, normal cycle and ovulation and then spontaneous pregnancy، فممكن تتعدل كليتهم. زين، لمن استعمل الاوفريان دريلينج؟ استعمله اذا مريضه كانت thin or despite of weight loss there is no ovulation. It's carried out through laparoscopy. Its success rate 60 to 80%, and there is less or no risk of multiple ovarian hyperstimulation. Complication, first of all, related to the risk of the laparoscopy, you know, it is a surgical procedure. Anesthesia, infection, bleeding, injury to the viscera, injury to the bladder, to the bowel, injury to the blood vessels. In addition to that, pain and hernia formation later on. In addition to that, there will be one of the complications of laparoscopic ovarian drilling is the ovarian failure due to destruction of the ovarian stroma. The slide on the left show you the laparoscopy, and on the right, we have the laparoscopic ovarian drilling. This slide also show you the laparoscopic ovarian drilling. Failure of ovulation lead to the shift to the third line, which is IUI with ovarian stimulation and IVF. This is in general the first line, second line, and third line. And thank you.